I am Dr. Shailesh Nisal, practicing plastic reconstructive and cosmetic surgery since the last more than 25 years. I was trained in the same from Mumbai and later on visited Australia and the United States to learn more tricks, gain more experience with various cosmetic surgical procedures. Facial plastic surgery. Facial cosmetic surgery is one of the commonest cosmetic surgical procedures being done for the obvious reason, because face is the most recognized, most seen part of anybody's body. So the consciousness about various parts of the face and enhancing the beauty of the face becomes one of paramount importance to many people. Of the facial plastic surgery, rhinoplasties are most common because nose changes the face altogether. But other facial parts also undergo cosmetic surgery, like for example eyelids. Drooping eyelids or aging eyelids can be corrected very effectively by a surgery called blepharoplasty. Facelift. An aging face can be made to look more youthful, more younger by doing facelifts. Facelifts has three parts. The upper face, which mainly involves the eyebrows, the middle face, which involves the cheeks, the nasolabial folds and the jawline, and the lower part, which involves the jawline and the neck. Nowadays, we are improving the results of facelift by adding liposuction or fat grafting to these procedures. So wherever there is hollowing, you can put in fat. Whenever there is some excess fat over the cheeks or below the chin, it can be reduced by doing liposuction. The shape of the ears can be changed. Some people have ears which look like bats. They are called bat ears or cup ears. They can be effectively corrected using a surgery, by doing a surgery called otoplasty. We perform facial plastic surgery in such a manner that scars are either not seen at all or are hidden. Now, how is that possible? Like for a rhinoplasty, the scar is totally inside the envelope of the nose. There is no scar seen from outside. The only part of the scar which is outside is at the junction of the columella and lip. So that is a part which is not seen at all. Or for example, eyelid surgery. We hide those scars in the folds of the eyelids. So hardly ever can you notice a patient who has undergone blepharoplasty or eyelid surgery. Even facelift, the scars are hidden in such a way behind the hairline or in the natural folds of our body or in the shadow of certain parts of our body, like the jaw, in such a way that these scars are not seen at all. The most suitable candidates for facial plastic surgery are the ones who are otherwise fit, whose skin tone is good. Again, common to all cosmetic surgery, who have realistic expectations, who have the right mindset to accept the change in the result that is possible. Like you can change your nose or chin or face on the computer in any manner you want. But in actual cosmetic surgery, these are live tissues and there are certain limitations which have to be accepted. So it can correct things in so many ways. Like recently, I had a young girl who met with an accident 2 years ago, who had a discrepancy in the position of the eyes. She had a defect in the orbital floor, which resulted in one eyeball being at a lower level than the other. Now, we could go into her orbital floor, define the defect, put in a barrier there, and both her eye position became normal. Similarly, a sharp, clear jawline can result in a very attractive face. Now, people can have excess fat deposit there, which makes their jawline ill-defined. That can be made very sharp by doing carving, liposuction, and stretching the skin across the jaw, resulting in a more good-looking face. Similarly, nose. Now, nose in itself is a body part which has many components. It can be made sharp, it can be made broad, it can be heightened, or humps can be reduced. A wide nose can be narrowed, resulting in a much better looking, more balanced nose on the face of many people. So these are all suitable candidates who should consider and go for facial cosmetic surgery. There are precautions to be taken after facial plastic surgery. One important component of this surgery is that the swelling takes about 3 months to completely reduce. So the initial swelling reduces in about 7 to 8 days, after which you can go back to work. So the downtime is not 3 months. But then for the final result to become clear, it takes that much longer because our tissues become soft, achieve an equilibrium after that duration. Till that time, you have to protect face from direct exposure to sun rays. In some procedures, massages are to be avoided, like after fat injections. After fat injections, you don't do massages. We specifically tell people not to do that. But against that, wherever there is a scar, massage has to be done by using a specific cream which results in that scar fading. Most important is there should be no pressure, no injury over the part which has been operated. Like after a rhinoplasty or a genioplasty, the person cannot sleep on their tummy. They cannot sleep prone, which will give untoward pressure over the operated part. In fact, for a duration, they can't even wear specs after a rhinoplasty. We advise them to go for contact lenses before the procedure because the pressure and the weight of the specs can alter the skeleton, the changed skeleton of the nose. In certain parts, applying a pressure garment for a specified duration, like during the night, is very useful in giving a better contour and a nice looking body part.